Okay. So, Bernadette, how you doing today? Do you go, by the way, first of all, let's just start with congratulations, but also, do you prefer to go by Bernadette?
I prefer either way works, Bernadette or Effia.
Afia. Afia is such a beautiful name. Now, tell me about Afia. How did that come about?
It's a name that originated from Ghana. So it's the day that it's a name or the day that you were born on. So I was born on Friday. So the female version of that name or of that day is Effia, and then the male version is Kofi. So
Oh.
there's a lot of Effias roaming around in Ghana.
But none like you.
Oh, I thank you, Sony.
This is well, this is so exciting. I was of course I reviewed all the applications and it was so exciting to see yours come across. And so I'm kind of curious when you found out that you had won the scholarship, what was your reaction?
Honestly, I was shocked. I actually had to refresh my email because I wasn't sure if I read it correctly. But when I saw it again, I realized, okay, I actually got the scholarship. I knew how competitive it is or was, and I can be very hard on myself sometimes, so I didn't expect it.
Mhm.
But in all, I felt really grateful, and I did get a little emotional. But it was more of a reassurance that like everything that I've been pouring onto others, like the outreach, the advocacy, the
Yeah.
long nights in PA school, like it all meant something. So it's just kind of reminding me that sometimes people see so much in you before
Yes.
you fully see it in yourself.
Yes, yes, I think that's very true, actually. Yeah, 100%, 100%. I always tell people I'm just some small town kid from Hickory, North Carolina. I had no idea I would do the things I did in life, right? I get it. So I'm kind of curious, who's the first person you went to tell that you got it?
It was a very close friend of mine. She's been part of my journey and has seen my growth in PA school. So it felt really special to share that moment with her.
Oh, that's sweet. That's so good. Now, do you know the other? Because there was two winners, as you probably know. Do you know the other person who won it?
No, but I'm curious.
Yes. So she is amazing. And I think the two of you absolutely should meet. Because you both share obviously many things in common, as you might imagine. And I think you would actually like each other. Your passion for mental health and primary care and underserved, I think is both. It was, I mean, and I'll be honest with you, as I looked, and Sarah and I talked about this, as I looked across all the applicants, both of you stood out like so strong. Both
Oh,
of you were
thank
like
you.
so strong. It was cool. And it was cool to be a part of that process, actually, for me. Um, so I'm kind of curious, to receive a scholarship like this, what does that mean for you?
It means a lot to me. I think like this journey to becoming a PA hasn't just been about school. Um, I've learned I learned so much academically, but I've also grown a lot as a person, and it shaped how I see people, how I listen, and the kind of provider I do want to be. So receiving the scholarship reminded me that all of the growth matters. Sometimes you're just doing the work and you're showing up, you're helping where you can, and you don't
Yeah.
really stop to think about it. So getting this feels encouraging. It also made me feel the want to keep going and continue to keep pouring into the communities that I care about.
Yeah.
And then also reminding me of my faith. So I believe in God. So
Yes.
God, yes. So God doesn't place obstacles in front of you that he knows you can't overcome. And that's something that have been said to me multiple times over my like journey in life. So
Yep.
there were moments in this journey that felt very overwhelming, but this felt like reassurance that everything was part of the process and that I'm exactly where I'm supposed to be. And I also think that it's a reminder that even when things feel small, they're not. So the conversations that you have, like the time that you give, the effort that you put in, like it all adds up. So I do hope that someone listening hears this and realize that their growth matters too. Sometimes you don't see the impact right away. And
Right.
that's something that I also need to understand and realize but that doesn't mean it's not there. So overall, that's the reason why receiving the scholarship means so much to me.
Yeah, absolutely. 100%. And I think, as you get into practice, one of the things that I hope you will always remember is that every interaction you have with a patient, every interaction, every nonverbal, everything actually communicates something to the patient, right? And like you said, the small things you don't even think about
Right.
actually communicate compassion, empathy, caring, and one of the things that you'll find over days of work is that you can get tired, and so it really takes how can I say it even? It takes like this internal learning to continue to the end of your day at the
Hmm.
last patient to go, how are you today? What's going on? And make them feel just as important as the first patient you saw that day.
Exactly.
Yeah, yeah, absolutely. And I think that's
You're
where your
like
faith
right
will come in.
on.
Yeah, I think that's where your faith will come in, right? Because you'll kind of depend on that strength from God
Right.
to do your job, right? Absolutely.
Yes,
Yeah.
exactly.
That's cool. Hey, so I'm kind
Thank
of curious.
you.
All the cool rotations, like we do all these cool rotations. Oh my gosh, I loved all my rotations, delivering babies, doing all stuff. What made you decide on mental health?
Oh, it comes from a lot. I mean, so I mentioned earlier about my name, Afia.
Uh-huh.
So I'm Ghanaian, so from West
Yep.
Africa.
Yep.
So growing up in Ghana, like the household and being around more of a traditional background, mental health just wasn't something that was openly talked about.
Okay.
Yeah, so a lot of times you were expected to like, yeah, just stay strong. You want to pray about it and then you just keep it moving. So you kept everything to yourself.
Okay.
So over time, I realized how much people hold inside, including myself.
Yes.
And as I went through my journey and later, like with patients, and I kept seeing the same thing over and over again. Like someone might come in talking about one concern, but as you listen, you realize there's so much more underneath. And I always use an analogy of an iceberg. Like you only see the tip, but there's so much below the surface that people are carrying.
Totally.
Um, so I remember one experience, I think it was like during street medicine. I was a children trainer lead, and so we help with street medicine. And
Mhm.
I spoke to a woman, and she had been through so much, including trauma, sexual assault,
Yes.
while living the streets. So at first, she was just like sharing pieces of her situation, but as the conversation continued, you could tell that there was a lot she was holding in. So in that moment, I was like, it's not about fixing everything. It's actually about listening and creating a space where she felt safe to talk.
Yes.
So that interaction made me realize that like it is important to understand that what people are going through beyond what's visible.
Yes.
So as far as mental health, like again, that's really what drew me to the area, just making or creating spaces where people can feel comfortable opening up.
Yes.
Especially those coming from backgrounds where mental health wasn't really discussed or always
Mhm.
discussed. And I want people to understand that taking care of your mental health is not a weakness and it's part of being human. That's what makes you strong. And so I do want to pursue this and I hope to encourage others that like listening to see that you can incorporate this into any setting. Whether it's primary care or if it's outreach or community work, any settings, it's just all about being present and just listening to the patient themselves.
Yeah, absolutely. And you'll find yourself, I think, down the road having to advocate for your patients, right? And so one of the things that I have run up against before is, people it's fascinating how our mental health patients will be treated differently than, say, a cancer patient, right? If
Yep.
I say I have cancer, everybody's like, oh, Sonny's got cancer. Oh, he's a hero. He's fighting cancer, right? But if I say I have bipolar or depression,
Hmm.
think how differently they treat me, right? Like, well, just get
Exactly.
over it. What's wrong with you? Can't you just move on? Can't you just get over it, right? And
Hmm.
I always tell, families and other people that, hey, you wouldn't tell them to just get over cancer.
Right.
You would be empathetic, you'd be supportive, you'd be, hey, we're with you, right? So they need the same thing when they have depression or bipolar or schizophrenia, right? Absolutely.
Exactly.
So that's great that you're seeing that and the importance there. That's great. Yeah, absolutely.
Thank
So now
you.
you have a job that you're going to be going to, right? You have a work you've accepted a job. Is that correct?
Not yet.
Okay.
It's processing. More in primary care though based.
Okay, yeah. Tell us about the community you're going to go to, and kind of, yeah, what's that community look like, and kind of what is your plan within that, the mental health piece of that community.
So yeah, thinking of going into primary care. I do want to focus more of like being a family medicine PA. Um, and then a lot of that came from like how I was raised. And as an NHSC recipient, National Health Service Corps recipient, it kind of puts me back in a place of working in my community, the underserved or the rural areas.
Yep.
So like when my dad immigrated from Ghana to
Mhm.
the US, he was actually homeless. So someone took him in and then helped him get back on his feet. So I grew up hearing that story. And like it meant a lot to me. So it showed me how much support can just change someone's path and made me
Yep.
more aware that not everyone has the same access to resources, including healthcare. And so I've seen how many people are juggling a lot at once. Like it's not even about a medical issue. There can be like stress from finance or housing, transportation.
Oh, yes.
A lot of those and or just knowing where to go like all of that affects how people seek care and how comfortable they feel, so that is the reason why I'm drawing myself into the underserved communities.
Good.
I do want to make care feel less intimidating and more approachable.
Yeah.
Yeah, I just want patients to feel comfortable coming in, asking questions, and being themselves. I mean, in these settings, trust, again, like we talked about, trust really matters. And I do want to be part of that experience. So, like with my dad's story, reminding me that all it takes is one person willing to help.
Yep.
I just want to be part of that support system for patients in the communities that need it. So, this is the reason why I am choosing to go into primary care and specifically family medicine, PA, and work with the underserved or the rural communities.
That'll be great. I mean, and that those areas, family medicine and primary care medicine in rural and underserved areas is such an important place to bring a kind of a emphasis or understanding of mental health, because I would tell you most family practices in these kinds of areas are in desperate need for somebody who wants to like have a good understanding of mental health and how to treat these mental health disorders, because nobody there, a lot of people throw their arms up and go, oh, psych, I don't know,
Totally.
don't want to do it, whatever, right? So bringing that to me, bringing that kind of piece or emphasis to that kind of area is like so critical,
Hmm.
so critical. And so, certainly, anything we can do to support your, deepening of knowledge of mental health disorders and treating them, of course, will always help. What part of the state are you going to work in? Do you know?
California.
No, no. What part of the state? What
Oh,
part?
part of the state. Los Angeles County, so more in like South Central.
South Central Los Angeles.
Hmm.
Okay. Now I'm not sure. I'm not from LA. Well, I'm not even from
Hmm.
California. Let's be honest. Listen how I sound, right? So, but I live in Northern California. So can you give me like an idea of what that area is like?
So the area that I'm currently in is it's downtown Los Angeles.
Okay.
And so you'll see a lot of like it's more Hispanic population, so Spanish speaking.
Okay.
And this is where I don't know if you heard of Skid Row.
Yeah, of course. Yes.
So, so it's more of like there's an increase of homeless population in this
Yes.
area.
Yes.
And then there's a lot of underserved communities that surrounds downtown LA.
Yes.
So yeah, that's really what the community or the area is that I'm
Oh,
in.
okay. Now, do you speak Spanish?
Yeah, so medical Spanish or conversational Spanish. So part of being at USC, we have like a course, a Spanish speaking course.
Mhm.
And so we learn Spanish, medical Spanish, and we are trained to be able to speak to patients without having to use um I forgot what it's called, but sorry, I forgot what the word is.
Translation?
Translation.
Okay.
So yeah, so I know during my rotations with Spanish speaking patients, like I really don't use translations as much.
Wow. That's pretty
Yeah,
impressive.
it is. And that's the reason
Okay.
why I chose USC is because they look at their community themselves and they know that there is a high population of Spanish speaking patients. And so, how can we train our students to impact that community, make sure that these patients feel heard and seen, and that is through language. And so that is the reason why they chose to incorporate Spanish course into our program. And yeah, so it's been helping. It's been creating a big impact. I would have never known to be trilingual, so
Right.
it's nice.
Wow. Muy bien. Es muy importante. Yeah.
Gracias. Thank you.
Wow,
Thank you.
that's
Yes,
exciting.
it is.
Um, so what are some of your, I'm kind of curious, what are some of your goals within the area of mental health? Where you're going to be? Because I mean, what you described, I've heard of Skid Row, I've heard of these places, right? And certainly the mental health needs are off the chart in these kinds of places, right? So what
Right.
are some of your goals within mental health in this area?
So as far as it goes, I think it stemmed from the question that I asked myself. Like, how would you feel walking to a clinic, sharing something personal, and then leaving feeling like you weren't really heard? So I think about that a lot. And because I also put myself in patient shoes, whenever I'm in a clinical setting, I ask myself, how would I want to feel walking out? And I would want to feel listened, to feel understood, and like someone actually took the time to know me, not just my condition itself. And so that's one of my biggest goals, especially mental health, because being heard is everything, and that is where everything starts. I don't want to know my patients just by their diagnosis. I want to know them as people, their
Yep.
background, what they're
Yep.
going through, what matters to them. Sometimes what someone is dealing with internally affects everything else.
It does.
So if we don't address that, we're missing like the bigger part of their care.
Mhm.
Another goal is to help rebuild trust. I mean, right now there's a lot of hesitation in medicine, um,
Yep.
especially in mental health, as
Yep.
we talked about, like with the whole cancer and then being diagnosed bipolar, schizophrenia. Like the interactions or the responses are completely different and could brush somebody off from
Mhm.
being seen. So I see it across different age groups and communities. Some people don't feel heard, some people don't feel understood, and just don't feel comfortable seeking care.
Yeah.
So I want to be part of changing that experience. And another goal is just expanding access, especially in the underserved communities and settings like street medicine.
Yeah.
I want to meet patients where they are and make conversation about mental health normal, feel normal and part of everyday care.
Yes. Awesome. Awesome. So, with the scholarship, how do you feel like this scholarship will help kind of support your goals and kind of where you're going with mental health in your community? How will this help support that?
I mean, it's supporting a way, like it feels encouraging. Sometimes you're just moving through the journey, like focus on school, outreach, and growth, and don't always stop to reflect. So receiving this reminded me that the direction I'm heading, that's the right path. It would support the work that I'm doing, moving forward, especially in the underserved communities. I do want to incorporate mental health into everyday care, like I said before.
Yes.
And this award reassures me that this focus is important. More than anything, it gives me the confidence to step into a practice and encourage me to keep trusting the path that I'm on, but also be able to share what I'm doing amongst other providers. And so that it could be more of a ripple effect that the work that we're doing is expanding and it's not at a pause or anything of the sort.
Absolutely. So, I can, by the way, did you receive these questions before I'm asking them to you, or are you hearing them for the first time?
No, I received it.
Okay, so I'm getting ready to throw one in you that was not in the list. So, do you feel comfortable treating pretty much all mental health disorders, or are there some that you're not as comfortable with? And in what way would you need support to feel more comfortable?
At the moment, I'm still in school. So I know new grad, post grad, it will be there's gonna be some confidence issue along the lines as I'm practicing. So I do know of certain conditions within psych or any mental health conditions. Um, Unfortunately, I wasn't able to work at like a rotation that was primarily psych. but I saw mental health condition throughout my core rotations, which
Absolutely.
actually helped.
Yes.
So there are certain conditions that I'm able to like pinpoint, and there's certain screenings that I'm able to use to help me understand, okay, like this is primarily the diagnosis, how I can treat them. But I know that there are certain conditions that I may not be able to understand or see at first hand. But this is the reason why support and community does matter and who you're working with, especially with like my supervising physician. If I'm not too sure of the condition, then I'm able to relay that concern and be able to push forward to understand, okay, this is the reason why this person has that. And so helps me for future cases.
Mhm.
As far as support wise, um, I mean, I know that you work in psych, so
Oh
uh,
yeah.
and so it's been inspirational. And this is the point where I'm able to just communicate with you or anyone that works in that field and help me raise more knowledge into that area. So right now, it's in all it's a confident issue.
Yes.
But I know that over time, I know that people have said that maybe 1 to 2 years in, you start to feel comfortable in yourself.
Yep.
So just having that support is very beneficial and needed during that first year of working.
Yeah, yeah, absolutely. Yeah, there's a growing number of us now that work in psychiatry, but I still do primary care medicine as well. And I also still work in underserved clinic as well. And so I think, one of the things that as I'm thinking about more PAs in psych and doing the kind of a combination of the two, psych, primary care, that kind of thing, me and Sarah and I have been talking about, kind of a supportish network to help new grads as they work through these difficult cases and some of them that feel a little bit overwhelming. And so, yeah, I want to make sure don't hesitate, to always call me or in contact me and say, hey, I had a couple of cases today or a case today that was I felt a little unsure about. Can I run it by you and get your feedback? Yeah, not a
Okay.
problem at all. Yeah.
Thank you.
Yeah. And so actually kind of the last question on the list, but who knows, maybe I'll come up with a number, you never know, right? Uh, so why do you think it's important? There's a lot of us out there, in underserved areas. There's a lot of PAs out there in underserved areas. There's a lot of us out there in the trenches working hard, right? Why do you think it's important to highlight PAs in these underserved communities?
Um, I do think that it's important because a lot of people don't always see like what's happening in these communities. When access is limited, it's not just about like the distance itself, it's about the trust, the resources, like feeling comfortable enough to even seek care. And PAs are often there in those spaces, especially like helping bridge that gap. And that's what I've noticed throughout my time as far as working in rotations, seeing how PAs are always there and how they're the center of the care. So they're not just treating the conditions, they're actually building the relationships. They're listening to the patients and becoming part of that community. And I think all of that just matters. And so when we like highlight this work, it brings attention to those communities that are sometimes overlooked. And it reminds us that people that have quality care shouldn't depend on where you live or the resources that you have. Like everyone deserves to feel supported and have access to like care that meets them where they are. And it also helps people understand that the impact that PAs can have. And I know that we are still expanding on our profession. And so just highlighting this will help people understand that, PAs are there for a reason. Sometimes even one provider in a rural or underserved area can influence an entire community. And I know that PAs are one of the main reasons as to why communities have been flourishing. And so they are able to like educate, they advocate and create environments where patients feel more comfortable seeking care. And I think that shows how we show up. And so honestly, just highlighting this work can inspire others too. It shows that medicine isn't just practiced. I mean, in large hospitals or anything, it happens in community clinics, FQHCs, like
Absolutely.
outreach settings, and places where the need is greatest. So it's really important for us to highlight those And just understand that like it's a ripple effect. Just because
Yeah.
you see us in the field, the PAs working in the rural underserved communities, it can help nurse practitioners or even physicians move in that direction too as well. Uh,
Yes.
yeah, so more of a ripple effect.
Yeah, yeah, I agree 100%. I think there's lots of positives about. I feel like sometimes I even think to myself, gosh, I know of so many providers out there in rural communities, even guys people I graduated with, that are in rural communities doing amazing stuff, and I feel like nobody even knows about it, you know. It's just so often I'm thinking of ideas of how can we highlight these people and what they're doing for their communities because it's just so much, you know, and it's so important. Gosh, you go out there, especially some of these smaller rural towns, and it's just they're it. You know, I've talked to so many folks in Tulare and Turlock, and let's go down the list, Chico and Clear Lake, and some of these more rural, Ready. I mean, all these places where these PAs are, and some of them even I've even literally talked to some that are afraid to retire because
Mm,
I don't know if there's anybody to come behind me.
wow.
And then they're like, well, they're like, I take care of thousands of patients in this area, and what happens if I'm gone, right?
Wow.
So I agree with you. Highlighting these things and encouraging others to come to these areas and solve these problems, I think is important. Yeah,
Right.
yeah,
Oh,
sure. Yeah. Is there anything else that you would like to say about, about the scholarship, about mental health, or about yourself that you'd want people to know?
I'm just very grateful. I'm grateful for Kappa too. You guys have poured onto me. It's the reason why I'm here today too as well, and how I'm showing up as a person. Um, I, I mean, as a student director, working with you, Sony, and the board members and everyone within Kappa community, you guys have highlighted a lot of a lot of areas that has been overlooked, and you guys are bringing it back to light, especially in California, especially with this mental health scholarship. I feel like a lot of people will be listening to our conversations and just seeing that, okay, like if Kappa can highlight mental health, why not start it now? You know? So
Yeah.
I do appreciate everything that you guys have done for Kappa, everything that you have done for our profession within the state, and advocating for our profession. You guys are doing a lot of great work. And the reason why I'm still showing up and I'm still being myself and I am a more of a compassionate and empathetic person, it's because of organizations like this, and Kappa is one of them. So I do want to thank you for just being who you are, being one of the best presidents here in Kappa. So thank you for showing up and showing how much this profession means a lot to you. So thank you.
Oh, that's so sweet of you to say. I really appreciate it. It's been great having you as student director, and it's my hope that you continue to be a part of leadership in Kappa. You've just been a real blessing, I'll be honest. And so I'm looking forward to watching you develop over your career. I think that's going to be fun
Thank
to see all the things you'll do. So yeah,
you.
absolutely.
And I can't wait to meet the other recipient too as well.
Oh, yes. I'm going to talk to Sarah about that. We need to make sure that occurs because you're in different parts of the state, which is a good thing, actually. And so I think it would be interesting for the two of you to talk. Yeah, for sure. We'll make that happen. Yeah.
Okay, that sounds good. Thank you.
All right. Hey, well, Afia, thank you so much for your time today and for all that you do and you're going to do. And I've enjoyed our conversation. So, yeah.
Thank you so much, Tony. Appreciate you.
All right, sweetie. Hey, talk to you soon, I'm sure. And have a good rest of your day.
Thank you. Likewise with you.
All right. See
All
ya.
right.
Bye.